Good afternoon, all. Am I audible? Is my screen visible? Please mention in the chat box. So today's topic is diarrheal diseases, page number 431 onwards, under the same chapter of medical nutrition therapy. Today we'll discuss only for diarrhea. Okay, later we'll do other disease conditions as well. So in diarrheal diseases, oral rehydration therapy is the main medical management and treatment that has been saving a lot of lives. Control of diarrheal diseases and oral rehydration therapy both were started around in 1980s. Okay, trials were also done here to understand diarrhea. What is diarrhea? It is the increase in the frequency, fluidity, and volume or bulk of the stool as compared to normal bowel movement or normal bowel habits. So, oral rehydration therapy and diarrheal diseases go like hand in hand. That is the first most solution. In pathogenesis, definitely diarrhea, chronic or acute diarrhea will lead to some fluid electrolyte malnutrition, protein energy malnutrition as well. The osmotic and the secretory diarrhea, which are like the watery diarrhea, okay, in which osmotic regulation will also be affected of the body. Digestion and absorption will also be reduced during osmotic diarrhea. In enterotoxin-based diarrhea like cholera, enterotoxigenic E. coli, okay, that's a causative agent. In rotavirus diarrhea, it's a viral disease. Again, absorption decreases and secretion increases more than absorption. What the body can absorb, that is reduced, but the output is increased. Okay, so that is the pathogenesis. Investigations, history collection, investigation, usually it's like 4 to 7 days. Within 4 to 7 days, you can make a complete diagnosis. Search for GI infection can be done taking some stool sample. Renal function test can be done through microscopy, pH test, malabsorption studies like stool fat study, chromatography study, biopsy. These things can be done to understand, exactly diagnose the cause of diarrhea. Coming to the management of diarrhea, a lot depends on the oral rehydration therapy, but based on the severity of the dehydration, you will have to take specific fluid treatment. Okay. So when a person has been severely dehydrated because of diarrhea, signs and symptoms are the person may be lethargic, unconscious, they will have sunken eyes, not able to drink properly. When you do the skin pinch test, the skin takes more than 2 seconds to go back to its original form. So that's a sign of severe diarrhea. Okay. So you have to give fluid for severe diarrhea. You have to do the plan C. Plan C is called the severe diarrhea treatment. Urgently, the child will be referred to hospital and the mother will be giving frequent sips of ORS on the way to the child. And if the child is below 2 years of age, advise the mother to continue breastfeeding, not stop that. If the child is more than 2 years old and there is a cholera outbreak in your area, immediately give antibiotic for cholera for the children. That is the plan C. In plan C, when you are giving the fluids, 100 ml per kg should be completed within 3 to 6 hours. Okay, whatever is the weight of the child, based on that, 100 ml per kg should be completed within 3 to 6 hours. Okay. Then some level of dehydration. The following signs and symptoms you will see: restless, irritable, sunken eyes, drinks eagerly, thirsty, skin pinch goes back very slowly. Okay. So in this kind of dehydration, just give me a moment. In some level of dehydration, you have to give fluid and zinc supplements from plan B. What is plan B? 70 to 100 ml per kg in 4 hours. Okay, that is plan B. And again, even in this, refer urgently to the hospital. The child has to be referred urgently to the hospital with mother giving frequent sips. Advise the mother to be with the child and return immediately if the child again shows some signs of dehydration. Within 5 days, if the condition is not improving, follow-up has to be recommended. If confirm if the child has some HIV infection or not. And within 2 days, follow-up is recommended if the child's condition is not improving. But 70 to 100 ml per kg is the plan B. We focus here every 4 hours. Within 4 hours, whatever is the weight of the child multiplied by 70 to 100 ml, depending on the level of dehydration, has to be given. When the child has no dehydration, no signs and symptoms of dehydration, you have to make sure that there is no enough signs. Like, for example, when you do the skin pinch test, you will not see any lag or time lag of skin going back. Here you have to give fluid, zinc supplements as well. Okay, home-based meal is given. Half to 1 glass of porridge of ORS, homemade, any homemade fluids like juices can be given. And if the child is showing some signs and symptoms of diarrhea, immediately ask the parents to bring the child back to the hospital. Okay, so that is the management, oral rehydration therapy management in diarrhea. This is what we follow. Contents of ORS: sodium chloride, potassium chloride, sodium citrate, glucose. These are the main contents of the ORS solution. So causes of persistent diarrhea or chronic diarrhea, which lasts for more than a week. If the child is suffering some malnutrition or micronutrient deficiency, okay, the child may suffer from lactose intolerance or acrodermatitis, enteropathasia, that is the scalp of the child will be completely inflamed, swollen, hair fall will be there, itchiness in the scalp. Post-enteritis syndrome, here the child will have sugar intolerance, lose protein a lot from enteroplasty, iatrogenic. So that is the signs and symptoms of post-enteritis syndrome. That also causes chronic diarrhea. Ongoing infections or recurrent infection. It could be some salmonella, typhoid, tuberculosis, whooping cough, giardia, that is a worm infestation, tropical flu, bacterial overgrowth. So these infections, if it is ongoing, the child will suffer from persistent diarrhea. Allergic or food sensitive enteropathies, gluten, cow's milk, soya protein, eosinophilic gastroenteropathy. Okay, these are the most common causes of food allergy or food sensitivities. Cow's milk as well. Malabsorption, monosaccharide intolerance, disaccharide or congenital disaccharide and monosaccharide intolerance, pancreatic insufficiency, enterokinase deficiency, microvillus atrophy. Okay, these are the cause. These could be the signs and symptoms that could lead to malabsorption. Immunodeficiency syndromes like anything that is acquired or congenital, any autoimmune diseases as well. Hormonal, vasoactive intestinal peptide syndrome or thyrotoxicosis, too much of thyroid medication if the mother was taking during pregnancy, that could also lead to some toxic effect on the child and cause hormonal shift in the child, that is hormonal. Surgical, peritonitis, pelvic abscess, malrotation of the short bowel, where the bowel or the intestine is rotated uh, in a different form. It is not anatomically in a suitable position. That is a surgical cause. And inflammatory bowel diseases, the child suffers from Crohn's disease, ulcerative colitis. Okay. So these are the irritable bowel disease the child will suffer from that could lead to chronic diarrhea. So steatorrhea, that is fat in the fecal matter, is a sign and symptom of persistent diarrhea. It's also seen, blood and mucus is also seen in the fecal matter. So dietary management of persistent diarrhea, you will have uh, level 1, level 2, and level 3. The same thing we had in nutrition and dietetics class as well. Different levels of diet. So diet A or level 1 diet is what you start with. It is a low lactose diet. Okay, you will start with low milk diet, 50 ml per kg per day. That is the low fat milk you have to give. Curd rice can be given. Suji gruel with milk can be given. Okay, that is you boil milk and water, and in boiled milk you will add suji and you will make a gruel out of it. Okay, so that is suji gruel that can be given. That is level 1, and see how the person or the child here is responding to level 1. Okay, if the diarrhea is not stopping, you will have to go to diet B, that is level 2. Here, completely remove milk. Milk-free diet is given, which means khichdis, a lot of pulses and legumes with cereals can be used, cereal pulse mix or gruel. Any amylase-rich food can be also given here. Diet C is level 3. Lactose, sucrose, starch-free diet, soya-based diet, chicken-based and egg-based diet can be given. Very few options you will have in lactose and starch-free diet, but it is protein focused. Okay, diet C is usually protein focused. So ORS also comes in different variations. Okay, you have hyperosmolar ORS, which has rice gruel in it. Super ORS, which is starch-based. Low osmolar ORS, that is most commonly used. Low milk and milk-free and starch-free diet can be also given in ORS form to make sure that they suit this either diet A, diet B, or diet C. So in level 1 diet, you can give milk, rice, sugar, water. Okay, that can be given. When you are doing a level 2 diet, cooked moong dal can be used, coconut oil can be used, water, sugar, rice, but you will not use any milk-free diet. And in level diet C. A whole lot of glucose and fat is the glucose, fat, and protein is the main ingredients here. Looks chicken, glucose, coconut oil, ORS solutions. Okay, these things can be given in dietary management. So amylase-rich food is also found to be very beneficial for children who are suffering from diarrhea or malnutrition. And amylase-rich food can be prepared at home as well. Okay, take any cereals and pulses that can be used. Whole grains have a lot of the amylase. Wheat has a high amount of uh, amylase. Flours of any sprouted cereals like wheat, millet, even millets, including ragi, jowar, bajra, they also have alpha amylase. So you have to sprout these like cereals or millets and even legume. You can sun dry them and malt it. Okay, then make a flour out of it. So you have to germinate them, dry them, and grind them into flour. That is how you make an amylase-rich food. This germinated cereal flour are high in alpha amylase enzyme and good source of protein as well. And it is one of the best food to start weaning as well. Okay, so you can whatever grain you use, soak them for with 2 to 3 times volume of water. Okay, if you are taking 500 gram of moong dal, okay, 1 liter of water or 1.5 liter of water should be used to soak them for 12 hours and then wrap them in a moist cloth for 48 hours. Okay. So 12 hours, just soak them, remove them and tie them in a cloth, muslin cloth for 48 hours, 2 days. And so automatically you will see the grain will start sprouting. And then finally you have to dry them. The sprouted grains has to be dried in sunlight for at least 8 hours. Okay. And then you have to grind them. Either you can roast them a little bit after sun drying them, roast them a little bit, and then you can grind them. This powder, whatever this flour that the ground flour that is with you, with that you can make a porridge. And it is a calorie dense porridge. Even a little bit goes a long way. Germination of the pulses will enhance its vitamin content, protein content. Next is amylase resistant starch. They have also been shown to be good in managing diarrhea. Banana, and especially the unripe banana, okay, unripe banana is a good source of amylase resistant starch. This starch is resistant to digestion, so it takes a lot of time to be digested. So it is good for people with diabetes as well. So it can why you want this resistant starch, so that it does not undergo digestion. It will stay in the intestine for longer time, and the intestinal bacteria, gut bacteria, will have this food for fermentation. Okay, so that is the motto of using amylase resistant starch. There are certain lactose-free diet as well for oral or NGT feeding. Tenolip, low-fat, Tenolip, lactose-free. Okay, these are the formulas available. Apart from that, coconut oil can also be given because it is a medium-chain triglyceride. It requires a lot of patience on the part of the physician and the parents to try various diets in succession, because you will be doing a lot of trial and error with a child who is suffering from chronic diarrhea. And some physicians will directly jump to diet C, that is completely protein based and fat based and carbohydrate based, apart from going from, instead of trying milk free or with milk, they will directly start with diet C. Then they will go to diet B and then go to diet A. And this exclusion diet, you can only use it for 2 weeks or 6 weeks maximum. After that, you have to start your regular feeding. You have to start your regular feeding in 2 to 6 weeks. Lactobacilli, medication can be given, curd can be given, IV amino acids can be given, plasma can also be given as adjuncts. Lactobacilli medication will be given for any chronic diarrheal cases. So prevention of persistent and chronic diarrhea, you have to use oral rehydration therapy, definitely continue them. And then we can use the mnemonic of zodiac, which means zinc. That stands for zinc. Zinc supplementation has to be is given. So zinc supplementation is given. Then O stands for oral rehydration therapy. Different forms of oral rehydration therapy based on the child's requirement is given. Dietary management is also done. Dietary management based on diet A, diet B, diet C. It depends upon the physician what diet they want to start with. Is it diet A, diet B, or diet C? Immunization, especially for rotavirus and measles, MMR immunization should be given in the 9th month when the child is 9 months of age. MMR vaccination immunization is given. Rotavirus immunization is also given if rotavirus is a common outbreak in your area. Antibiotics should be used judiciously only and if only if the child has a bacterial infection which has been found as a positive agent for persistent diarrhea. Only then put the child on antibiotics. Otherwise, unnecessarily don't give antibiotics. Cleanliness in the area where food is prepared, hand hygiene and cleanliness of the food preparer, okay, mothers, servants, maids or hospital staff, anyone who is preparing the food, where the food is being prepared, the way how the food is served also, okay, cleanliness and hygiene has to be maintained. So that's about diarrheal management.